ميوت لللابتوب الاثنين. Good evening, everyone, and welcome to the ELMS second orientation webinar on medical training in Europe. I'm Razan Bouaid, a third-year fellow of family medicine in Hôtel Dieu de France and Université Saint-Joseph, and my colleague, Melissa Keriakos-Saed, the chief resident of general surgery in Saint George Hospital University Medical Center. Allow me first to remind you that the EuroLebanese Medical Society, who was founded in June 2020, has a main goal of connecting the Lebanese healthcare professionals in Europe and Lebanon to work together for a healthier Lebanon. For more details, you can visit the website on EuroLebanese.org, where you can also review the past achievements of the society. You will find a series of webinars on COVID-19, where Lebanese and European professionals shared their expertise on this topic. And you can also join some humanitarian interventions on helping Lebanon, especially after the tragedy of the 4th of August. And of course, the ongoing youth orientation webinars for complementary studies in Europe. In fact, 2 weeks ago, our first orientation webinar was discussing the studies in France. If you are interested in reviewing the rerun, you can visit the website, you can subscribe to the YouTube channel of ELMS, and you can also follow the pages on Instagram and Facebook of the EuroLebanese Medical Society. So tonight in the second orientation webinar, we will be discussing your journey to the land of Hergé and Go, which is of course Belgium. Melissa and I will be accompanying you throughout the webinar. You can ask any question by typing them to the section to your right. Feel free to ask the questions in English or in French, and we'll be gladly answering you shortly. And now I will leave you with Melissa.
Good evening, everyone. I'll be presenting our speaker for tonight, Dr. Fadi Dalati. He's a urologist specialized in minimally invasive endoscopic, laparoscopic, and robotic surgery. He got his medical degree from the University of Belgium and his urology diploma from the University of Balamand as well at St. George Hospital University Medical Center. And he pursued his fellowship at the Université Libre of Brussels in Belgium. He trained in different European countries such as Austria, Germany, Spain, and France. He's currently working at the Saint-Pierre University Hospitals in Brussels. He's also a member in many European medical societies. Dr. Dalati will present us with everything that we need to know about the possibilities of training in Belgium. Dr. Dalati, you may start.
Good evening, everybody. First of all, I would like to thank the organizers for the humble invitation. And hopefully today we will go through the steps, administrative and otherwise, regarding medical training in Belgium. I would like to thank Melissa for presenting me. We're going to start right away. Here we go. All right. So I'm a urologist working at CHU Saint-Pierre in Brussels since 2015. And we will divide this presentation into two parts to make it more interactive. So the first part will be about how to do a fellowship in Belgium, what are the legal requirements, what are the eligibility criteria, and how can you secure a place for doing a fellowship. Then we're gonna have a break and ask some questions and respond to your questions. The second part will be about if you wanna continue your career in Belgium, what are the steps and how to go through the jungle of administrative process. First of all, I will start with an introduction. So Belgium is a federal kingdom, and it's divided into three regions. So the north of the country is called Flanders, and that's the Dutch-speaking part of the country. And then you have the south part of the country, which is the French-speaking, called Wallonia. And you have the capital region, Brussels, which is officially a bilingual city, but 90% of its current inhabitants speak French. So it's the lingua franca of the country. As well as English has a huge importance in the city as it is the capital of the European Union. So why this is important? Because with the federalization of the country, the competence about treating medical degrees has been divided between the region and the federal government. So before 2013, everything was handled by the federal government through the Ministry of Health and Public Health. However, after the Réforme d'État, these competences were divided between the region and the federal communities. So for example, if we're talking about the equivalence of Diplôme de la médecine, تعديل شهادة الطب العام, this is a regional competency. So you need to submit your file either to the Flemish part, who speaks Dutch, or the Francophonic part, which is Wallonia. However, if you want to work and have a number legally in Belgium as a doctor, you need something that is called visa de diplôme, which is the equivalence of إذن مزاولة المهنة عندنا بلبنان. And this is still a federal competence. You need to address to the federal government of the country. And to make things even more complicated, if you want to have an equivalence of your specialty diploma, then you will have to address the universities, either the Dutch-speaking or the French-speaking. And that's in short how life is in Belgium, so Magique Belgique. So since the country is divided linguistically between the Dutch and the French-speaking, so are the universities. There are a lot of universities in Belgium, but those who are related into medical training can be divided into Francophonic ones and Dutch ones, mainly Université Libre de Bruxelles, ELB, Université Catholique de Leuven, Université de Liège, et Université de Namur. So these are the main four Francophonic universities. On the Dutch part of the country, there is the Vrije Universiteit de Brussels, which, as you can tell, it's the sister university of ELB. They were divided after the Réforme d'État. Same thing happens for the second university. So it's still the Université Catholique at Leuven, and it's the sister university of UCL. And then you have the University of Antwerp, Ghent, and Hasselt. So if you have a diploma coming from outside the European Union in medicine, you are not allowed to practice medicine in Europe. However, in Belgium, there is a special law called the Article 49 Ter, which gives those who had finished their medical training, basic medical training, outside the European Union, and currently doing a specialty training in their last year of the training or newly graduated, so 1 to 2 years after the finishing of your specialty diploma, you can have a limited specialized access where you can actually practice medicine, but under strict supervision by chef de service or maître de stage. So this is the legal aspect that can actually allow you to start your fellowship in Belgium. But that doesn't cover the financial part of the equation, because you still have to finance your fellowship. And this is where universities comes in play. Other conditions that need to be taken into consideration, of course, are language requirements. So if you are applying to do the French part of the country, you need to know French, and at least at the level of DELF B2. Same thing happens to Dutch universities, with the special exception that sometimes there are programs in the Dutch part of the country being taught in English, which means that you can actually talk the chef de service there, and you might actually have the chance to do your fellowship in English rather than Dutch. And another important condition, that you need to be registered into a university at your country of origin, because they consider once you are registered there, at the end of your fellowship, you will go back to your country of origin and you will not stay. So one of the conditions to obtain the article of there is that you are still a university student doing your specialty, or as I said, recently graduated. And therefore, Université Libre de Bruxelles decided to actually benefit from this article and provided a scholarship that is called FOSFON. So basically, it's a scholarship by Bay network, and there are a lot of hospitals affiliated with the university. And they will provide the financial aspect. Not only will they provide the residency visa in order to come to the country. I will leave the link for the official site of the FOSFON, where you can have much more information about the eligibility criteria, when to apply, the time framing, and all of that. So basically, ULB went a little bit farther, and they decided to do a partnership with several universities in Francophonic countries, Lebanon included. They have now a partnership with the University of Amman, with the Lebanese University, and if I'm not mistaken, with USG. Correct me if I'm mistaken. So what they do actually is that there is you apply for the scholarship online at the dates that is given, and then a jury coming from Belgium, including members of the university. Usually it's Dr. Issam Nakadi, who is a general surgeon working at Institut Jules Bourdet and Hôpital Erasme. He's a general surgeon specialized in esophageal cancer surgeries. So he will come to Lebanon, to the universities that have partnership with the ULB, to do, if you want, an interview with the candidates. So it's a kind of a procedure of a pre-selection. It's something like the matching. So they know what the hospitals in Belgium need, and they know the applicants, and they will just filter those during the interview. Of course, the interview is not only done in Lebanon, it's done in all the countries where there are partnerships. That doesn't mean that if you're not from Balamand or Jama Lebanese, you cannot apply to the scholarship. You can apply even if you are not into these two universities, and you will have the chance to sit in front of the jury. But logically speaking, your chances might be a little bit lower than those actually affiliated with the universities who have a partnership with the ULB. So the network of hospitals that actually affiliated with the ULB are a lot. So in Brussels regions, you have Hôpital Erasme, you have CHU Brugman, this is a university hospital, Institut Jules Bourdet, the reference center in oncology in Europe, CHU Saint-Pierre, the reference center for infectious disease, Hôpital des Enfants, Clinique Saint-Jean, and there are a lot of universities scattered around the French part of the country. So you have hospitals in Tournai, in Mons, and Liège, and Charleroi, and vice versa. So this is a little bit of a draft timetable of how things happens in the FOSFON. So between the month of November and February, you are asked to go online and actually apply for the scholarship, see if you are actually checking all the eligibility criteria. Between January and March, the jury will actually be visiting all the countries, and the pre-selection procedure will happen. In April, the selection of the candidates will actually be done by the jury, and you would receive an acceptance letter. Between May and July, usually August, this is the procedure where the FOSFON on your behalf will actually present your file to the immigration authorities in Belgium in order to get the RT count, Nifter, and then the residency visa so you can actually come to Belgium. The academic year in Belgium starts in October, not in September as in France, which gives you a little bit of advantage because you have a little bit more time to apply for the fellowship compared to France. And of course, it's for 1 year that could be renewed for a second year, depending on the situation. And back in my days, we're talking 2013, the financial support was 1,800 euros that is exempted from taxes. I don't think it changed a lot, but there's an inflation rate and accordingly the amount will be adjusted. UCL, Université Catholique de Leuven, actually had a similar program. It's called the Bourse CD3S, and they divided their fellowship into 2 parts, so either partiel or complémentaire. Partiel are for those who are still in training, so they did not finish their training yet. Complémentaire are for those who recently graduated. At the end, it doesn't matter a lot. It's just the title of the certificate at the end that is different. You can actually check their website. They have a lot of information, and what is nice about UCL is that they actually provide an Excel sheet with the addresses, the name, and phone numbers and emails for all the maîtres de stage and chefs de service of different specialties. You can actually contact them and try to see if you can actually have a place in their hospital. So it's more direct connection with the hospital that you might end up at the end. And that would be the end of the first part. I'm gonna stop sharing now and we're gonna take some questions and I'll happily answer them. So back to you, Josiane and Melissa.
So I'll start with a question concerning the exceptional session for FOSFOM that opened for Balaman residents, and I don't know if it's for other residents as well. We've been sent an email from the university that there's an exceptional session of FOSFOM that will start by January 2021 for 1 year, and the interviews will be around mid-October, and applicants should apply by now up until next week, till 12th of October. So I would like to know more details about this exceptional session, and if you know anything about it, and if it's the same as the usual FOSFOM, the usual one that opens up by January, I assume.
As a matter of fact, the Parliament of Brussels, after the explosion of 4th of August, had a meeting and they were discussing ways to support Lebanon and the Lebanese population during the crisis. And one of the ideas was to actually open a specific session of scholarship coming from ELB for Lebanese resident exclusively during an exceptional year that starts in January instead of October. So if I understood correctly, it's between January 2021 and December 2021, or is it, yeah, 21, 2020 actually. So you need to go to the website, the same website, and you need to apply. And since you are from Lebanon, if I got the information correctly from the office of FOSFOM, you can actually apply. There will be a jury, and the idea is to get some Lebanese residents to finish their training as a one-time opportunity. So it is open for Lebanon. I'm not sure it's only open for the University of Balaman. In all cases, the secretary of the FOSFOM told me earlier today that you should go to the website, you should apply for the scholarship, and then you will go through the criteria. And if you're accepted, then a rendezvous with the jury will be programmed later during the year.
Okay, thank you, Dr. Dalati. There is a question from Grace Aii, who was asking, what about the residency programs? So if someone ended his medical school in Lebanon and wants to proceed to Belgium to continue his specialty there, is there an option for that?
Well, this will be covered with the second part, but I can answer briefly now. There is a way, but it's rather complicated and a little bit difficult because residency program in Belgium are open to Belgian students and also to the whole of the European Union. And there is a tendency of students coming from Italy, from Romania, and from France to do residency in Belgium. So places are already limited, and there is a huge competition between European students to gain these places. So the classical way, finishing general medicine and then applying for residency in Belgium, is a little bit complicated. It's not impossible. There is always a way, but priority goes to Belgians, then to European students, and then to international ones. And there are several administrative obstacles that makes it a little bit complicated. So the better way to do it, if you want to continue in Belgium, would be to start the specialization in Lebanon, and then go there as a fellowship or as a complementary to your basic training in Lebanon.
Okay, and one more question. Is there a difference in procedures between the Lebanese university and Balamand to apply and from the other universities, the rest of the universities in Lebanon, or is just the priority of the jury for choosing?
It is exactly the same procedure with exactly the same eligibility criteria. The only difference would be the selection by the jury, which by default will favor those who are coming from universities with a partnership with the ELB. But it is not limited only to these students. And during this years, I'm here in Belgium since 2013, I've seen people coming from Jamal Arabi, from USG, from Kaslik. So it's not limited to Balamand and the Lebanese University. Everybody can apply. Another thing that's very important that I missed during the presentation, we presented two scholarships, one from the UCL and one from the ULB, the FOSFOM. But the training and the opportunity is not limited to these two scholarships, because if you can finance your training either by the hospital in Belgium or even by the hospital in Lebanon sometimes, if you can provide to the Belgian authorities that you have enough financial support to support your training in Belgium, you can still get the article 49 there. And I know a lot of people from Lebanon, a lot of doctors who were specialized, and they actually gain financial support from the hospital in Belgium. So it was not by the university, it was done by the hospital outside the university network. The hospital decided to support them financially, and they applied a joint application to get the article 49, and they got it, and then the visa for the residency, and they did it. At the end, you will not gain a university certificate. So it might affect your graduation at the Lebanese university. But for those who actually finish their training and they're looking for an opportunity, this might be another way. So you need to actually fulfill two requirements. The legal requirements with the article 49. So you need a hospital or a university in Belgium willing to accept you for a year of fellowship. And you need to meet the financial support. So you need an entity supporting you. It cannot be self-support. It cannot be your family. It has to be an institution, an organization. And it doesn't matter if this organization is Lebanese or international or Belgian. Same thing goes for the Dutch-speaking universities. We will talk at the end of the presentation about tips and tricks and about how to gain a spot in Belgium. And if you have connections with the hospital or with the chief of service or with a surgeon or internal medicine specialist, he can actually promote your file. He can ask specifically for you to come into a training. And it happens all the time, and it's completely legit way to come into the country. The scholarship, the advantage of scholarship, whether it's FOSFOM or ECL, is that they are handling everything. So they're handling the administrative part and the financial part. So from your point of view, from your side, you only have to apply and get an acceptance. And the rest, it's done by them, which is faster and more practical.
So Dr. Dalati, there is a question from Kamal Motley. He's stating that there has been a law that the Parliament of Belgium elaborated recently, that they will be increasing the number of accepted trainees. Could you elaborate on that, please?
Well, that's exactly what you talked about the special FOSFOM cycle that's starting in January. So the Parliament of Brussels decided to increase the number of scholarship on the number of article 49 given to specialized doctors from Lebanon to come and study in Belgium. And the ULB got the chance and decided to increase its scholarship, meaning because every year the universities and the hospitals in Belgium, they have a quota for international students. Let's say they are 100. So now with the decision from the Brussels Parliament, they increased the quota. I'm not sure of the exact number, but because they increased the quota, FOSFOM decided to actually benefit from that and invite more students. So it still falls into the same category.
Okay, and one more question. The choices of hospitals and regions in Belgium is dictated by the jury of where we apply our file, or is it by preference, according to the preference of the resident that is applying the file?
Well, of course, knowing the program in Belgium, or knowing the chef de service, or knowing someone who was there before you will actually help you, because it's a matching system. It's like in the States. So you actually put your preferences and the hospitals put theirs as well. And therefore the matching happens. So if you have a direct contact with the chef of service or the maître de stage in Belgium, and he knows that you are willing to come here, and he actually wants you, or she wants you to be his resident or her resident during this year, he can actually tell the FOSFOM, well, I want Dr. X to be with me next year. But this is not inclusive. It's a matching system, and the FOSFOM tries their best to actually fill all the places in the Brussels, the capital, and in all other regions. That being said, it's very important to understand that in Belgium, it's not like in Lebanon. So hospitals, peripheral hospitals in peripheral cities have the same weight and the same academic level and medical level as the capital, if not even more sometimes, because it's a very federalized country. So every city has its own government, if you want, and its own laws, and they always try to improve their medical training. So just because you are not in Brussels, you are in Mons or you are in Charleroi, doesn't mean that your training is going to be of less effectiveness. By the country, it might be even better. But to answer your question, it really depends on the personal connection that you have. So if you have someone from university who already went to Belgium, and he knows that you have service, and he can actually put some good words with you, if you can actually have a direct contact with these people, you can already improve your chances. And this is why I think what UCL is doing with giving you the Excel sheet with all the names and the contacts is a very good idea to improve your chances and to be there in a program that you actually want and aspire to go to. But there are no guarantees. It's a matching system, so you might actually ask for a hospital in Mons and get a hospital in Brussels and vice versa. This is, of course, going through the scholarship, but if you went through...
Okay, so now we will proceed to the second part of the presentation. It's about practicing in Belgium, and we'll be leaving the rest of the question to the end of the session.
Okay. So if you want to continue your career in Belgium, that's meaning you need to do the equivalence of your diploma and your specialty diploma and working as a specialist in Belgium. We need to go back to the first or the second slide where we said that the competencies were divided between regions. So the first step is to have the equivalence of your general medicine diploma. And as I said before, this is a regional competence. So you need to submit your file to either the French part of the country, and this is the Fédération Wallonie-Bruxelles, and you have the link where you have more information about how to do the equivalence, or the Dutch part of the country, which is called Naried-Vlaanderen. Now, a little bit of history. The Dutch part of the country are very independent and they want to gain independence from the rest of the country. So whenever they have a new competence, they develop laws rather fast, and they are more efficient than the French counterpart when it comes to administrative purposes, because the French part, they don't want these competences and they are not seeking segregation. And this will lead to the fact that if you are to apply at Fédération Wallonie-Bruxelles, the procedure can be extremely long. Actually, there are no deadline. So your file might stay there for 6 months, 1 year, 2 years without having a response. And usually when you get a response, it's very rarely to be a positive one. especially for those of us coming from English-speaking universities. There have been cases where people coming from the Lebanese University and USG who got their equivalents through the French, the Fédération en ligne Bruxelles. But even though they had a positive response, they were obliged to repeat several years or several courses before they gained the recognition of general medicine. We're not yet talking about specialty, we're talking only about general medicine. And of course, you need to submit your file in French. So if you're coming from an English-speaking university, you need to do a whole lot of procedure of translation, including the syllabus of your training, which is costly, and you need someone who actually knows what he's translating in order to have a rather acceptable dossier. On the contrary, if you're going to the Dutch part of the country, you can actually submit the file in French or in English or in Dutch. So those coming from French universities can apply with their own language. They don't need to translate anything. And those coming from the English-speaking universities as well. And there is a deadline. So once you apply and you get a confirmation that your file has been submitted, within 3 months, you will get a response, whether it's negative or positive, but you will get a response. And if they don't get back to you within 3 months, it is already an automatic positive response. And we had a lot of precedent cases from people coming from the Jama Lebanese, from USG, from Balamand, from AUB, who actually got the recognition by the Dutch government without even repeating courses or years. So from a practical point of view, if you want to continue your career in Belgium, and the first step, which is the equivalence of the general medicine degree, it makes sense to apply for Nederlander, so on the Dutch part of the country. And then you have the second step, which is visa de diploma. It's the equivalence of إذن مزاولة المهنة عندنا بلبنان. And this is a federal competence. So you need to address the federal government, that is the Ministry of Public Health. And since it's a federal government, there are two branches, the Dutch one and the French one. So if you went through the French route, your file must be submitted in French. And if you went through the Dutch route, your file must be submitted in Dutch. Now, I said before that it would be better to go through the Dutch route because it's more guaranteed. You might tell me that I don't know Dutch, so how am I going to go through the second step? Well, what you can do is you can actually register into a Dutch course that is recognized by the Dutch government. And with your motivation letter, you can explain that you already speak the second language, official language of the country, which is French. You are registered into a Dutch course, and you have a commitment to speak the language by the end of the procedure. And that's a positive note, because they say that you already speak the first language of the country or the second language of the country, and you are committed into learning Dutch. So it happens and it works. Once you have a positive response from the Ministère de Santé Publique, you will get something that is called registration as a general medicine. And you will have a number registration called the INAMI number. It's more or like which ends with the number 000. And you need this number in order to be able to practice medicine in Belgium and in order to apply for registration or equivalence of your specialty degree. So at this step is a competence of the university. So it's not the federal government that will decide, and it's not the regional government that will decide. It's actually the university themselves. So you need to contact the universities, whether the French-speaking or the Dutch-speaking one, and you need to submit your file to something called Comité d'Agrément. This committee is actually made of specialists coming from all different universities, either the French one or the Dutch one, depending on which university you are applying to. And usually they decide if your competence is equivalent or your specialty is equivalent to the one that is being given in Belgium, or if you need to repeat some years. To give you an example, I come from Balamand, and urology in Balamand is 5 years. But in Belgium, urology is 6 years. So when I applied to the Comité d'Agrément, they actually asked me to repeat another year so they can have the 6 years the same as the Belgians. Something that is extremely important, something that's extremely important here, the FOSFOM years that you do in Belgium, or anything you do under the Article 49 Ter, cannot be counted as years of specialty. So let's say your training is for 6 years, you did 5 of them in Lebanon, and then you did 3 years or 2 years of Article 49 Ter in Belgium. For this committee, they do not count the 2 years that you did in Belgium under the Article 49 Ter. So this is important because you need to count the amount of time needed in order to gain your recognition. Once you meet all the criteria and the committee d'agrément agrees on your file, you will get a numero INAMI that is for the specialist depending on your specialty. I have the link where you can go to the Fédération Wallonie Bruxelles and understand more in French the procedure. The same procedure can also be done on the Dutch part of the country, but at this level, you need to have a good knowledge of Dutch in order to apply. In some cases, if the maître de stage really likes you and you are doing some subspecialty that is very rare, they might actually not consider the Dutch as a requirement. I would go with English, but this is very rare. So this is how you do it. The procedure in time, it takes about 1 to 2 years to be completed. So some tips and tricks that might actually improve your chances. As I said, it is a matching system. So if you have publications as a first author, if you are a member of scientific associations related to your specialty, if you have already participated in conferences, or if you have submitted posters and you win prizes and you presented your work at any international conference, all of this has a great role into advancing your file. The French part of the country relies a lot on personal relationship, as we said before. So if you know the chief of service, or if you know someone who's your friend who was here in Belgium before you, and he can actually put some good words for the chief of service here, this might advance your file as well. If you are here as a fellowship and then you decide that you want to try to stay in the country, use these FOSFOM years in order to establish good relationship with all the specialties, with all the directors in your specialty. If you have a good relationship with the chief of service, your fellowship will be more fruitful for you. So if you're a surgeon, for example, you will be able to do a lot of specialized surgeries, or you might actually be interested in certain type of surgery, let's say robotic surgery. And if you have a good relationship with the chief of service, you will do more robotic surgeries. If not, then you will do a normal rotation. And of course, once he or she, the chief of service, believes that he wants you to stay with them, they can actually help you a lot in the third step of the recognition. Once you have a numero INAMI that ends with 000, you can actually apply for your specialty. And once you have the numero of your specialty, you can work in all parts of the country. So in a very Belgian way, you can actually do the first step, the recognition of general medicine in the Dutch region. You can then do the recognition of your specialty in the French region and work in Brussels. Because once you have the numero, which is coming from the federal government, you can work in all the parts of the country. And of course, as I said, if you're going the Dutch route, you need to start into a course in Dutch. So you can do that once you start your FOSFOM years. And this will help you for the second step of the procedure. So that is, in general, without going into further details, the complexity of the medical training in Belgium. One of the advantages that you have in Belgium is that there is no post as chef de clinique as it is in France, meaning for those coming for surgical training, you don't have someone who is newly graduated who is going to take all the surgeries for himself or herself. Actually, you have an open and fair access to all surgeries. You have your own clinic. And if by the end of the clinic you actually organize a surgery, you will be the first surgeon on the patient. So it's a very good opportunity from a surgical point of view. I hope I was clear and concise. And of course, I'll be waiting for all your questions. Thank you very much. Back to you, Vivian and Melissa.
Thank you, Dr. Dalati. There is actually a question from Ms. Nesrine Haidar. C'est possible de continuer le master en parodontologie, donc elle est une dentiste de l'Université libanaise en Belgique et pouvoir travailler après dans le pays. Vous avez parlé durant le webinaire concernant les médecins plutôt que les autres spécialités dans le domaine médical. Est-ce que c'est possible pour les dentistes aussi?
Oui, pour les dentistes, c'est plus ou moins les mêmes règles, c'est les mêmes lois, article 49 ter, et je pense, je ne suis pas sûr, mais je pense que c'est exactement les mêmes procédures. Mais je ne suis pas sûr s'il existe de bourses dédiées comme le FOSFOM ou comme le UCL pour faciliter le passage. Mais on va dire de loi, oui, le loi, en fait, c'est pour les médecins généralistes, pour les dentistes et pour le pharmacien aussi.
Another question from Samir Aid. He's in PGY2 internal medicine at St. George Hospital. He's asking if it's possible to apply to FOSFOM as a second year of internal medicine, or he should finish all 3 years and then apply as a fellow.
Well, as a matter of fact, internal medicine, the first 3 years of internal medicine are not yet the subspecialty. So if you want to really, because you will gain the degree of internal medicine, and then you will apply as a cardiologist or as a gastrologist. You cannot apply because you are not yet registered as a gastrologist, as a residency, as a resident of gastrology in your country. So you need till you are officially in a subspecialty of internal medicine before you can apply. And they actually state that you have to be in your last year or the year before your last year of specialty. But of course, these are guidelines, so there are exceptions. And if you know the chief of service here in Belgium, and he or she advances your name, you might actually get in. But again, this is an exception to the rule.
Okay, one more question from Mark Saab. Est-ce qu'il y a une restriction aux spécialités auxquelles on a accès en tant que Libanais? Et s'il y en a, lesquelles? Et donc, c'est tout.
Il n'y a pas de taux de restriction, c'est ouvert pour tout le monde, n'importe les nationalités, n'importe les religions. Le facteur limitant, c'est vraiment les places disponibles. Chaque année, il y a des places pour les PG, c'est-à-dire les résidents belges et européens, plus les places qui sont dédiées pour les médecins internationaux. Et ça, évidemment, inclut les Libanais. Mais il n'y a pas de restriction. Mais évidemment, les places, par exemple, pour la chirurgie générale, elles sont plus nombreuses par rapport, par exemple, à la chirurgie plastique. Mais ça, c'est tout à fait normal parce que le numéro total de places en chirurgie plastique en Belgique est limité par rapport de numéro de chirurgie générale.
Another question. Many are asking if there is a possibility of subspecialty in Belgium. So Kamel Motley gave an example. If you're a cardiologist, for example, is there interventional subspecialty spot or echo spot, or and how things would be organized?
Of course. You can actually, when you apply the FOSFOM, you can actually specify what type of subspecialty you want. For example, when I came here, the first year was general urology. The second year was specifically into laparoscopic and robotic surgery. But of course, in order to gain the subspecialty, you need to know the people who are working there. So you need to know the doctor or the chief of service, and you need to contact him or her in order to gain the subspecialty. The places are more limited, and there are more competition for these places. And now you are competing with the residents who are already starting their career in Belgium. So yes, it is possible, and usually it happens, but not during the first year, because the first year will be to get used to the country, to get to know the people there. And the second year will be the more specialized one. And the way that people actually do it, they leave Lebanon at their last year of training. So at the end of the first year of FOSFOM, you are already specialized in your country, in Lebanon. And you can actually do a master complémentaire. It's not partial anymore. And as such, they might take you into subspecialty because they say, well, you're already specialized in your country, and now you need to do subspecialty. It really depends on personal relationship and knowing the program that you want to go to and the people responsible for that program. Back to you, Josiana and Melissa.
There's no more questions. So at the end of the second webinar, I would like to thank our speaker, Dr. Fadi Dalati, for his intervention, the organizing committee of the ELMS, and all of you for watching and joining. I hope that this webinar was fruitful to all of you and that we were able to answer all of your questions. If you have any additional question, our team is ready to answer you through our website, EuroLebanese.org. Please register and leave your questions in the question and answer section. You will also receive in the upcoming days a link for the rerun of the video. Also, you should know that by subscribing to this webinar, you are now part of a big family, the ELMS, that will help you and guide you whenever you need it. But to become a member, you should be a European resident of Lebanese roots and apply through the website. That's it for me.
Thank you very much for the opportunity and the lovely invitation. I think the work that's being done by the organization
it's my pleasure to announce that our next webinar will be on the complementary medical training in Switzerland and Romania. The date will be announced soon. To keep track of the updates, please follow the EuroLebanese Medical Society page on Instagram and on Facebook. Thank you for joining. Thank you, Dr. Dalati, and until next time. And Dr. Fadi, do you have any last words?
Well, I want to thank you, Josia and Melissa, and the wonderful team that is making these webinars happens. I believe the organization is doing great help for all the Lebanese doctors who are trying to improve their situation and their specialty. I hope I was able to give a summary of the situation in Belgium, and hopefully we will see more and more of these webinars and more of questions. Thank you very much and have a very nice evening.